A big hello to all my fellow practitioners. I hope this video finds you well. I wanted to make a short video going over some of the main equipment supplied and instruments we use as practitioners, as there has been a little confusion in the past. Okay, first in line we have the all-important standard nail nippers used for general foot care and nail trimming. Then we have the Black's file, used to file right down the edge of the nail deep in the lateral nail fold, as the foot file will be too big to use in this area. The 8-inch diamond deb file, used for general filing of the nail, reshaping, and to help reduce the thickness of the nail, along with the use of burr buds. Ingrowing nippers. We use these as a separate instrument if the client has an ingrowing toenail and the standard nippers are too big and cumbersome to slide down into the lateral nail fold. They are far more accurate and allow the practitioner to nip tiny sections deep inside the nail fold. Burr buds. There are several types of material burr buds are made from, including diamond burrs, tungsten carbide burrs, and ceramic burrs. We now supply the latest technology, being the ceramic burr, as they attract less heat and stay sharper for longer. All of your existing burrs are still fine to use, by the way. Burrs with a black band are the roughest, and you should have a label in your bag giving you the roughness of each burr. They are mainly used for reducing the thickness of a nail, reshaping, and can also be used to burr away infected parts of the nail. Bull burrs. These burrs are also now ceramic and are mainly used to remove small infected parts of a nail and other small and hard to reach areas, and can be used alongside the above standard burr during the same treatment if needed. There is not much difference between the blue banded ball burr and the red banded ball burr, artery forceps, or mosquito grips. These are mainly used when performing a PNR. The artery forceps can be used to grip the section of nail after the first cut has been made. They will give good control over the offending section of the nail and allow the practitioner to accurately nip down the side of the nail within the lateral nail fold. Once the last cut has been made, the practitioner can then gently take the detached part of the nail away and check the result before deciding to go back in. Double-sided or paddle file. These are big steel or aluminium file used for removing thick, lumpy, and very rough sections of skin. The black sections of sandpaper that sticks on these are called grits. When the grit worn to the point where it needs changing, pour boiling water each side of the file onto the grit to loosen the glue. Peel off and either use a Stanley blade to scrape away the remaining glue. Sometimes IPA on a cloth is good for removing the residual glue before sticking on a new grit. Fleecy web. This is the pink sticky material mainly made by Hapla. Hapla pink fleecy web is a type of padding material commonly used in podiatry and chiropody. It is often employed to provide cushioning and protection for the feet, particularly in areas that are susceptible to pressure, friction, or rubbing. This padding helps to alleviate discomfort and prevent the formation of blisters, calluses, and other foot-related issues. It is often used in conjunction with other foot care treatments and products to provide comprehensive care for various foot conditions. Tubular bandage, used to dress the toe after performing a PNR, partial nail resection, and other treatments where the toe needs to be dressed and protected from the elements. Use between 2 and 4 layers and apply using the tubular bandage applicator provided. If the procedure leaves a wound, then you may want to use Inidine. Inidine non-adherent dressing can be used to manage ulcerative wounds and to prevent infection in minor burns and minor traumatic skin loss. Make sure that the client is not allergic to Inidine before applying. Cut a section of Inidine, place on the wound, and place a dressing over the top. After applying the tubular dressing, cut off at the correct point, pull down to the bottom of the toe, and use Haplaband tape to secure in place. Inidine should not be left on for more than 2 days, but can be changed twice daily. However, in general, Inidine should not be used for more than 10 days. We want all of our practitioners to feel fully supported, so if you have any questions about your practice or education, then please contact the office or your line manager, where we can further support you. Allied Foot Health, leading the way in the world of foot health.